Hi, I'm Steve Kep, co-founder of From Day One, our forum on corporate values, and we're looking forward to hosting today's webinar. But before I do, I want to share something special we have for attendees of today's webinar. Our next monthly virtual conference is coming up on Wednesday, July 21st, and it's titled Diversity's Many Roles, How Mentors, Sponsors, and Allies Each Play a Part in Inclusion. Thanks to our partners and today's sponsor, we have some complimentary VIP tickets available for those who've joined today's webinar. That's you. I'm putting a link in the chat right now. You'll want to take advantage of this one because the regular price for our conference tickets is $149. And this link will give you a free VIP ticket for the whole day's activities. Today, we'll be exploring the topic, the future of telehealth in a post-COVID-19 world. COVID-19 has dramatically accelerated adoption of telehealth solutions by doctors and healthcare consumers, and employers cite getting a successful telehealth solution in place as a top concern for 2021. As the world emerges from the pandemic, what does the future hold for telecare, virtual care? How can telehealth address the inefficiencies of the standard healthcare system and help companies drive better, cost-efficient outcomes? Summus CEO and founder Julian Flannery will share insights into this larger question, as well as those closely related issues. The sustainability of consumer and physician appetite for virtual care as a sense of normalcy returns, the impact of deferred healthcare driven by the pandemic, the rise of next generation virtual care models, how a focus on the provider experience will play a critical role in the future success of virtual care, and finally, the factors that companies should consider when they're selecting a telehealth partner. Our sponsor today is Sumas. I'll tell you a bit about them. Sumas Global, the leading virtual specialist platform, empowers families by providing access to a network of 4,000 plus top specialists across 48 leading hospitals within days from anywhere in the world. The Sumas model sets a new standard for speed of access to high quality medical expertise and drives industry-leading engagement with employers. Pioneering the future of corporate health benefits, Sumas Global partners with companies across the country to create an elevated healthcare experience for their employees and to support better, cost-efficient outcomes across all health questions and stages of care. Now, a few quick logistical items before I turn it over to our speakers. This webinar is being recorded and it will be available on demand soon after the event. So you can look out for an email in about 24 hours with the link. That email will also have info on how you can get professional development credits for this session from the Society of Human Resource Management. And look out for a written account of the conversation on our website at From Day One. Now I'd like to introduce our moderator, Lydia Dishman, a staff editor for Fast Company, who's an expert on such topics as technology, leadership, and the workplace. She's written for CBS Money Watch, Fortune, Popular Science, and the New York Times, among others. Okay, Lydia, over to you and our guest speaker.
Thank you so much, Stephen. Thanks everybody for joining us today. We are excited to have this discussion. And I just want to preface it by saying, I love that Steve called me an expert, but never more than this past year have I felt like a total rookie about everything because we just have not known anything. And despite the best preparations that anybody could make, no one could prepare us for the tsunami that last year dished out to us. On so many levels, the pandemic just being one of them. So anyway, to prepare for this discussion, I came across some commentary by Meg Barron, who is the AMA's Vice President of Digital Innovation, who reported that even prior to the pandemic, telehealth visits and remote patient monitoring had doubled between 2016 and 2019. This AMA digital health study surveyed 1,300 physicians at that time and found an increase from 14 to 28% through 2019. But since the beginning of the pandemic, Barron estimated that the number skyrocketed to between 60 and 90% of physicians using some sort of telehealth services. About half of those, she estimated, were using those approaches for the very first time. A totally different but no less interesting metric that I came across is that telehealth has set the investor world alight. Before the end of last year, according to CB Insights data, telehealth startups had raised $2.6 billion across 194 deals. And that was on pace, they said, to set a funding and deal activity record in 2020. At the time, they estimated that by the end of the year, it would increase to 6.6 billion with a B across 490 deals. So clearly, we're at an inflection point. But what does the future hold? So to discuss and perhaps gaze into the crystal ball a little bit, we have Julian Flannery. And so first, I'd like you to introduce yourself and actually tell us how you came to found the company.
Yeah, it's a funny story. So Lydia, thank you for having me from day one. Thanks for having us. So I'm the founder and CEO of Sumas, and I don't need to belabor what we are. We're a virtual specialty care platform. When we talk about telehealth, there's multiple dimensions of telehealth and virtual care, and we can get into that. But the founding story is really premised on, I come from a family of doctors. I have an uncle who's one of these world-class specialists. I deeply understand the mindset of the physician and in particular the specialist. The other piece of history is the sort of the job, so to speak, that I had prior to founding the company was at a company called GLG, Gerson Lammer Group, which is the largest what's called marketplace for expertise in the world, professional expertise. So my co-founder and I really sat down and we said, well, what if we did GLG for healthcare? And GLG, again, is really the premise there is connect people with people who know stuff so that people can make better decisions, right? Mm-hmm. So we really took that and said, look, let's look at healthcare. We looked at the second opinion category, we looked at telemedicine, and we saw really incomplete solutions. And then on the physician side, back to my family history, there's a massive undervaluation of the stuff that's in the doctor's head, right? The actual expertise that physicians have. And in healthcare, really on the consumer side, there's real challenges in accessing doctors. Primary care doctors are tough to get appointments with, but specialty care can sometimes be really difficult. Can take you 3.5 weeks to get an appointment, can take you 6 months to get an appointment. Oftentimes you're doing very localized solutions with, wherever you are. So there was this really interesting opportunity to put what's called a marketplace model in the middle of healthcare, where we could solve for that inefficiency in physician expertise, and then we could help consumers access high quality doctors really from anywhere in the world quickly, within hours and days. And so what Sumas does, and what I think it's really special is, we really solve a pain point for physicians. We like to think of ourselves as the leading doctor's choice. Incredible physicians love Sumas because we have a mission to change the value of their expertise. Right? And then on the consumer side, we're able to say to healthcare consumers who are at employers or wherever they are in the world, you can come to us with any health question, and that can be pediatric allergies, it could be pregnancy milestones, it could be weight management, all the way up to ALS and cancer. And our promise to our consumers, our members, is really to have them connect with really high quality doctors quickly, spend quality time with them, help them understand what they need to do in healthcare, and ultimately feel more powerful in what is a really challenged system in healthcare. And that's kind of what we are. We in our sort of pre-call, we talked a little bit about,
tell us about the name.
Yeah. Whether it was Sumas or Summus, and the reality is it's pronounced Summus. I pronounce it Sumas. And the story is I started the company, and about a year in, I was having lunch with a friend of mine who went to a fancy Northeastern school and majored in classics. And I said, I founded this great company called Sumas. And he's like, do you mean Latin, Sumas? And I was like, yeah. He said, well, it's Summus, you dummy. And so there I was,
like that.
There I was a year into my company, and I named it wrong. But anyway, I pronounced it wrong. But we stick with Sumas because I just can't get rid of it. So.
And for the benefit of those who did not take Latin, what is the derivative?
Yeah, so Summus actually means pinnacle. It means best. So we really stand for quality technology, quality of the service that we bring, and the clinical excellence that we bring to the market. And I'll talk a little bit about sort of markets going in that respect.
Well, listening to your story, I couldn't help but notice that, and so many founders actually use this language, that you're solving for pain points. This is a critical, pardon the pun, pain point. Do you think the healthcare system in the US is broken? Is that what you're trying to solve for in a larger scale?
You, Lydia, will appreciate this, right? So I think that's an exaggeration, right? The healthcare system is certainly not perfect, but there are a lot of countries around the world that would love to have the US healthcare system. And let me sort of caveat that, right? So there's a lot of companies that also talk about transforming healthcare. You know, we seek to be a little bit more humble around that.
The name notwithstanding, though, I mean, the best. Go on.
That's fair enough. But it's not about us. It's about, we're actually like built for the provider, right? And so that's really what we stand for. Sorry, where was I? Where your question?
Talking about the healthcare system being broken.
Yeah, the healthcare system being broken. You know, the reality is we have some of the best medicine in the world. People from all over the country come to this, or all over the world come to this country to get treated, to get surgery done, to access the latest clinical trials. Medicine is certainly, in my opinion, you know, top 3 in the world. We have some of the best academic medical centers in the world. And also doctors come here to train from all over the world. That said, the actual healthcare system is a real challenge. And that's because you have big embedded constituents, you know, insurance companies, carriers, health systems, whereby their incentives are not necessarily correlated with the consumers, the healthcare consumers, sort of imperatives and priorities, right? So whether it's profitability, whether it's optimizing a network, whether it's lowering costs, those things can sometimes get into the way, whether it's pricing transparency, whether it's access, right? The medical centers in this country are competing intensively, right? And states are competing intensively through licensures and whatnot to keep people in there within their health systems. So I would say it certainly is challenged, and I think in many ways companies like ours are seeking to improve it, right? And ultimately, what you're trying to do, in my humble opinion, is very simple. You're trying to optimize for the consumer experience. You're trying to get them better access to high quality healthcare quickly, you know, across their healthcare journey. And then on the physician side, you know, 46% of physicians feel burned out with what they do, right? And these are some of the smartest people. My smartest friends in the world are all physicians, right? And so, you know, we have to solve for the physician problem as well, because if we don't solve for that, in many ways, they're the center of healthcare. And you know, we at Sumas believe that if you improve the physician experience, you actually, you know, by default, improve the consumer experience. So yes, but you know, we have incredible innovation, and I think you quoted, you know, $6 billion in telehealth. There was, I think it was close to $17 billion in the first half of this year in digital health. So that's across the components, not just for care, but across the components of healthcare.
Well, so, okay, we're talking about solving for these pain points. Doctors certainly are essential workers, and we have celebrated or tried to celebrate essential workers throughout the last 16 months. And so if they are at the center of this, can you walk me through how it works for them? And then we'll talk about the consumer experience.
You mean in virtual care? Yeah, so it really depends on the use case. So if you're talking about virtual primary care, which is telemedicine, is in state, you know, the doctor has to be licensed in the state to engage with you, or they have to have a prior patient relationship with you. Okay, so that's kind of telemedicine. In specialty care, you know, if you're engaging out of state virtually, it's a different kind of relationship. You actually can't practice medicine, but what you can do is advise and guide and provide, you know, input on what a patient can do. So the benefits for virtual care on the physician side are really, especially in specialty care, is that, you know, they're not just localized to that, you know, that market where they practice. They're able to take their expertise and really scale it across the country and candidly scale it, you know, around the world. So the physician, what's amazing, so I'll quote a data point, 80% of physicians will actually use telehealth and virtual care post-COVID. And this is the fascinating aspect. If you look at historically what's happened when radical transformations have happened, and this is what COVID did. You know, we're sitting here on Zoom, right? I'm not sitting here with an audience in front of me. But the reality is, just like the future of work, which I'm sure is an interesting conversation, in medicine, both sides love it. So 76% of consumers will want to use virtual care post-COVID. Matter of fact, 36% of millennials actually think that virtual care is better than in-person care.
Yeah, well,
Unsurprising.
well, I was going to say that's a generation that spends a lot of time on their phone. So this makes total sense. Yeah,
exactly.
Go on.
But here's the critical gating item, which is the physician side, right? So, you know, where I used to have to go to, our company used to have to go to HR heads and say, hey, well, you know, virtual care is cool. And it's, you know, you don't always have to go to in-person care. COVID transformed that. And then on the physician side, you had these, I don't want to call them stodgy physicians, but they were forced to do virtual care. And what you hear from them is highly efficient, allows me to connect with the patient. You know, they're not staring at the back of my head while I'm looking at their images. I've got it right in front of me. It's actually a very personal experience. I can scale my expertise, so it's not just my local market. And so on a volume basis, on a connectivity basis, and on an efficiency of time basis, which is how physicians measure their day-to-day, is superior in many ways. So I think, you know, the physician experience will continue to expand. I mean, there's a Cleveland Clinic data point that says in, I think it's 5 years, 50% of outpatient visits will be virtual. 50%.
Well, and I was going to ask you about the, you know, the current trends, and you've spoken to that a little bit about how, you know, this is definitely going to continue on post-COVID. But you did also mention that physicians are burned out. But at the same time, they want to scale their expertise. Doesn't that kind of counteract?
It doesn't, because, you know, if you talk to our chief medical officer, who was an ER doc, you know, for 15 years at New York Presbyterian here in town, you know, she would do a lot of emergent telemedicine appointments, and it's really efficient. You just kind of crank through them. And so I think the burnout is actually from administrative task items on the physician side and regulatory burden, right? So fear of stepping over the line of, or, you know, getting a lawsuit, or dealing with paperwork, or, you know, understanding how payments are flowing through their practice. Like, that's all the piece that is burning out physicians. I think in many ways, virtual care is actually enhancing the experience of physicians.
Because they get to do what they signed up for in the first place.
Exactly, which is connect with humans to solve important problems, right?
Okay.
Yeah.
Well, I was also thinking about, we've all gotten used to seeing people on a screen now, but I can't.
Yes.
And most people think of healthcare as a high touch experience. You know, you're going to get the stethoscope on your chest, like they're going to pound your stomach, and for those of us who are ticklish like I am, just send you into fits of giggles. So how does it work when a physician is just on screen? Are there some specialties that are more suited, or can any specialist do it effectively?
Well, again, in primary care, it's a little bit easier, right? And it's telemedicine. It's the practice of medicine. So I can open my throat, they can see inside, you know, that kind of stuff, you know, acne, dermatologic things. I've got a fever of 102.6. These are my symptoms. You can actually sort of guide a person to high quality care in that realm. Specialty care is a little bit different, right? So it's a little bit more complicated. Again, sort of can be really anything. Now, you're not going to necessarily get a diagnosis virtually, but you might get informed on what your symptoms mean. We get a lot of people that come to Sumas that they have all these different things, and it's called a wandering diagnosis. They're trying to figure out, is it neurological? Is it something else? Is it rheumatological? You know, that kind of thing.
Okay.
So in many ways, you can inform the consumer virtually on paths they need to take, tests they need to get, all that kind of thing. The other thing it does is it speeds up the sort of the ability for healthcare consumers to understand what they need to do in healthcare, right? So a physical exam, they need to happen, right? Blood work needs to happen, right?
Yeah, has to happen in person until we figure that one out virtually.
Exactly. And well, you could get labs to the house or to the office, right?
Well, sure.
But I do think there are clear use cases for in-person care, and there are clear use cases for virtual care, and that's the way healthcare should be, right?
Mm-hmm.
It's not going to be 100% virtual. It should definitely not be 100% in person because it's just more efficient. Let's say you saw a specialist, you're in Manhattan. Let's say you went up to Yale, New Haven, which is an hour and a half, 2-hour drive maybe for you. Like, what if you've already seen that person and you just need to do a checkup on sort of, how am I feeling? What are my symptoms? What's going on? You could do that telephonically, but it's nice to connect with your doctor by video, and you don't have to drive 4 hours round trip plus the wait in the waiting room, right? It's just a different experience, right?
So if I'm understanding this correctly, what you're advocating is a hybrid approach, yes, just like the future of work will likely be some sort of hybrid. But these specialists, do they become like your doctor, especially if they can't really diagnose, they can't come across state lines? Like, what's the value there for the consumer? Like, just trying to get like a second opinion, perhaps?
Yeah, we don't like to use the word second opinion purely because it's such a narrow category.
Okay.
Look, we get our average feedback on the consumer side for consulting with our experts and even our Sumas MDs who are ER trained is at about a 9.6 out of 10, and we've done thousands of these over the course of 2-3 years or so. The value you can get by spending quality time, 30 minutes, 45 minutes with an expert via virtual care, via telehealth, they're looking at your medical history. They're looking at your, you might have gotten blood work done. They're looking at your scans. The value you can get from connecting with a really high quality doctor who might be out of state. They might be down at MD Anderson. They might be at Kentucky Hand. They might be at Stanford. They might be at Johns Hopkins. But the ability to connect with a really high quality doctor who's very deeply specialized at the top of their field in your particular disease or condition is hugely valuable. And the reality is, 99% of academic medical center physicians, those insurance takes they're participating in those insurance plans for commercially insured populations, right? So we see a lot of, if you consult virtually with somebody at Yale and you just are delighted by that doctor's insights and their experience, you might say, wonderful, I'm going to come see you in person for care or whatever I need to do from a treatment perspective. And that's sort of how it works out.
Mm-hmm. And are you seeing a lot of those types of conversions, or is it just mostly consultations?
Yeah, we do see a lot of conversions. There's, it depends really on the geography and on the situation. If somebody's going to be, if it's a cancer diagnosis, or if somebody's got a something that'll require ongoing care, you might want to engage from Manhattan at the doctor in Stanford, but you may not want to fly out there, right? So there might be some, part of our curation process is what's the optimal situation for your long-term care. Are we just trying to get to the best insights quickly, irrespective of geography, or are we kind of localized in terms of providing access? Realize we have a lot of New York members, and they still do virtual care through us, even if they're doing it with New York Presbyterian physicians or Sinai physicians. Same concept. So.
Well, you try commuting even now with half the people riding the subway is still too many people. Exactly. But by necessity, a lot of people had to defer healthcare last year because they couldn't get to the doctor. The doctor wasn't taking in person, not really doing telehealth as broadly. Do you think that telehealth has the potential to reverse the potential impact that had for those people who couldn't get to doctors during the pandemic?
Look, you're talking about deferred care, basically, right?
Mm-hmm.
Yeah. There is deferred care is important, right? So you can't do a mammogram virtually, right? You can't do a colonoscopy virtually, right? So there are
too bad for both of those things.
Yeah, exactly. But to your point on deferred care, like if you spent the year and a half, not doing your checkups and you were 55 years old, not to get sort of overly extreme about it, but like that's a risk window that you fail to do, you get screened, right? And so I talked to you, and I spoke about this briefly, and I talked to our chief medical officer, and it's really hard to, there's no hard data right now on the true impact of deferred care. There's a very strong inference, especially among oncologists, that there will be an impact years down the line, because you might have a greater number of people who didn't get screened for the last year and a half, 2 years, who might be more advanced stages of a diagnosis. And then I think also you have a situation where people who are deferring their elective procedures, right? You see this a lot with, we work with HSS a lot in the top orthopedic hospitals. If you're going to get your knee replaced, you're like, well, maybe I'll just wait. I'm hanging out in my house, with a mask on. I don't need to do this for a year and a half. And so, I think a lot of your audience here who are thinking about healthcare costs and whatnot, those surgeries might start sort of compounding, if you will.
We are going to get to the HR portion of the discussion. So for our audience, fear not, but I do want to remind everyone, because we are coming up on the half-hour mark, to, if you have any burning questions for Julian and want him to look into the crystal ball for you personally, please feel free to drop those into the Q&A box, and we'll get to as many as we can when we're at the quarter till mark. I'm thinking about, we often hear about food deserts, and how there are some places, even in urban areas, where people do not have access to good, fresh food.
Yeah.
Do you see Sumas as being a solution, shall we say, for a healthcare desert?
Yeah.
And how would that work?
Yeah, no, it's a great question. And the definitive answer out of Proof is yes. We work with a lot of clients that had distributed workforces across the country. And I'm not talking just about people like us, people who are, on partial health plans and whatnot, who are, turning the wrenches on automobiles or whatnot. And we can really serve as a digital front door or an access point to high quality specialty care. And so we've got a lot of cases where people are extraordinarily grateful. They don't know what to do, and suddenly they see this number on their employer's website, or they see this link where they can quickly sort of just type in a box and like Google for Sumas. That's how we design our product. And suddenly they're on the phone with a really high quality internal medicine or ER doctor who's helping guide them understand what they need to do, their challenges. Even most basic is, I've got these 3 meds. How do I prioritize? Like, should I be taking this? Should I not be taking that? So it's really powerful. And, part of the joy of running this business and the fulfillment is really, you see these stories all the time, and it's not just about the people sitting in Manhattan. It's, the future of work, as and the future of many companies, people have workforces all over the country, all over the world. We support a fair amount of US companies with international operations, where we're not helping them with, on the ground kind of referrals and whatnot, but we are helping them access US based care in terms of just talking to a really high quality doctor to understand what they need to do. And that's proved to be really, really powerful. I think it's not just Sumas. I think virtual care by default has the ability to transcend, so long as you have broadband and Wi-Fi, it has the ability to transcend, boundaries. I will say though, there are people who are employed at companies who aren't like us checking email every day. They're not on their phone. So you have to morph the application to suit the sort of work style and daily. We have some clients who we're only able to reach them after 5 and before 8 a.m. right? And that's because they're on the assembly line or whatever they're doing, right? And so I think the answer is definitively yes. And I would say broadly in virtual care, that's the opportunity for a lot of companies. Yeah.
Yeah, and I was particularly thinking about hourly workers. You mentioned assembly line, but really just, any of the essential workers beyond the healthcare workers during the pandemic, people working in grocery stores, people working at Amazon fulfillment centers. Yep. Is it possible for those people to get on board with something like this, or is it something that it isn't really totally accessible to them?
Well, it is accessible. Sometimes they're intimidated by it. They don't really know what to do. There's a cultural element where, oh, I just want to go see my doctor in person and I trust that person.
Mm-hmm.
And even though I've got a giant tumor, he tells me I'm fine. Like, there's a stubbornness sometimes that's there that you have to sort of convince and change behaviors on. But I think it really, the opportunity is really there, and it's really a challenge for us as a company aligned with our clients, because I'm sure you talk to many people in your audience. There is a real challenge to getting to those people,
Mm-hmm.
and not only incentivizing them, but getting them to want to call companies like ours, right? Because it's just not part of their how they think about things, and
Mm-hmm.
that's just whether it's cultural, whether it's professional, whether it's they can, not accessing technology, or whether or not they're just very stubbornly loyal to their local doctor.
Mm-hmm.
Right?
Yeah, we've always done it this way, so why
Yeah.
should we change? Yeah.
Exactly.
But I'm also thinking about there are certainly privacy and security issues that come up
Yep.
when people are thinking about doing something like this. I don't know this person, and now I'm going to get
Yep.
on a video call with them, and
Yep.
all my sensitive information is going to go out there. So what about the privacy and security factor?
So what's really interesting is that healthcare consumers, if you look at the data, like Mercer publishes all this good data, I think it's something like 70, greater than 70% of consumers are totally willing to share their records and their medical data with third-party providers for.
There goes that out the window for $5
Yeah.
in
Yeah.
Amazon bucks.
Exactly. We don't see it much, because I think part of what we need to do when we go through the procurement process with our clients is, you do go through the ringer. It's not just, hey, is your solution good? Is it secure, right? Are you GDPR compliant? Are you SOC 2 compliant? Are you high trust compliant? Are you PCI compliant? Like, these are all things that companies like ours have to go through.
Mm-hmm.
And then, you have to build processes that build trust in the consumer, right? So nothing happens outside of our platform. Right? Nothing. There's no like emails. You and I you're not emailing me records. Like, you just go into our platform and everything gets done in there. And it's like a box, right? It's a secure box, right? And so companies like ours, you can, knock on wood, privacy and PHI, private health information, is sacrosanct. You design permissioning even between family members.
Right.
And I think generally, even if people don't know that, again, I sort of quoted that number, I do think at the end of the day, consumers really value accessing high quality providers, high quality health systems, and they're very willing to kind of share their data.
Mm-hmm.
There's an element of trust with physicians that isn't necessarily there with the carrier, right, or the insurer, right? So,
yeah, and I'm thinking about also for the HR folks in the audience, and I know that there are many. You mentioned compliance, so can we just put that little bit of an issue to bed, because I am going to ask you about building a business case for this, but let's tackle that first.
Yeah, I mean, compliance. Compliance. Look, I mean, every one of these contracts we have with the folks on the phone has a bunch of compliance, restrictions that we have to abide by.
Mm-hmm.
Companies have what's called information security reviews.
Mm-hmm.
You have to provide documentation and all that kind of stuff. COVID has loosened those restrictions, right? So cross-border telehealth. Doctors are doing virtual care from their iPhone FaceTime during COVID, and so
yeah.
But the realities are the reality, and the reality is the reality, which is ultimately, state medical boards are going to have oversight over licensing. There's a reason they do that.
Sure.
There are innovative things happening, like physicians getting licensed across 30 different states, in a very highly efficient manner. And so they can deploy, practice medicine across 30 different states. But companies like ours have to be super compliant, because it's like financial services. you cut one corner and you're done. You just don't want to do it. You know?
Well, and but I think that, when we're talking about mindset and having to change mindsets, I think that a lot of times, especially if you are in an HR position, like you can't take any chances. And when you hear startup, you're like, oh, are they just sort of like sticking it together with duct tape and cobwebs and hoping for the best? But of the HR professionals that I've spoken to, they consistently tell me the focus of benefits is shifting to be more employee driven. They're not just, offering your standard healthcare package, your standard 401k, blah, blah. So how is your company ensuring that the patient is well served so that these HR professionals can offer this package to them?
Yeah, I think it really goes back to where is virtual care going, right?
Mm-hmm.
And so I've had many conversations with senior HR professionals across the country, and what's historically happened. You sort of quoted the numbers of invested dollars going into virtual care companies. People have designed what I call it the tapestry problem, right? So
that's a good way to put it.
Yeah. So you have companies that have said, okay, like this mental health thing is great, and this fertility thing is great, and this second opinion thing is great, and this telemedicine thing is great, and we need a navigator. And so you've ended up with about 15 different solutions that are stitched together. And what ends up happening is the overall spend is fairly high, and the consumer is hopelessly confused, right? The employee is hopelessly confused. So they're just like, okay, what am I doing here, right?
Yeah. Open enrollment sends fear in the hearts of many an employee.
Exactly. But I do. So I think the market's moving away from that tapestry problem to one where it's really about, give me a model that allows me to broadly engage people, right? Whether that's services or a model like ours, where we say, hey, Lydia, you can come to us with any health question. Doesn't matter what it is, right? And we're gonna get you to a high quality doctor in a curated way who's going to help you understand what to do in healthcare, right? The second piece is quality. You mentioned compliance, and I'll say this. I'll just say it sort of bluntly. There are some schlocky companies out there in sort of telemedicine. No, I mean that, right? Because there's a race to sort of be telemedicine, virtual care. What I've seen is really good diligence on behalf of the consultants that the HR professionals work with and the heads of benefits on, is this a really quality solution? And I think that is the future of virtual care in a lot of ways. And I'll give you a really important number. 74% of consumers believe that accessing top doctors and accessing the health system that they're being treated at is the number one thing in healthcare, even above out-of-pocket cost. 74%, right? So there has to be this focus on quality. So when you think about a virtual care solution, it's really about, okay, what's the tech? Is it secure? What's the engagement model? But what's the quality of this network? How do we, is this telemed just a negative selection bias where people have a lot of time and they're just going to be, doctors who aren't really that great talking to my employees? So I think really sort of when we think about our solution, we're on the forefront of quality. We're in specialty care. We've designed a platform that is a leading doctor's choice in specialty care. And that means a lot because back to this data point, people really value the relationship with their doctor. That is the most trusted thing in healthcare. So I would say, when you think about, your question was more related to Sumas, we create a really broad funnel inside employers, right? Migraines, cancer, doesn't matter. Come to us, we'll help you connect with a really high quality doctor. We focus obsessively over the doctor experience. We want to make it incredible for them because if we do that, they'll spend more time with our members.
Right.
And they will have a good experience with Sumas. And here's the interesting thing about specialty care is that there's only a certain amount of doctors that are available to do this. So you really want to be the platform where the world's best doctors want to hang out. Because if they don't want to hang out, you're done. So I would say
it's like the elite lounge at the airport,
Exactly. But importantly, Lydia, it's driven by market forces, right? So they don't come to us because they like me. They come to us because we create an amazing experience for them, and because we
Right.
change the value of their expertise, right? So.
Well, we are getting quite a few questions from our audience, so I'm actually going to flip over a little bit early and make sure that we can get to as many of these as possible. Douglas wants to know, what type of utilization reports do you make available to employers who look to implement your program?
Yeah, so we have a pretty cool dashboard that really breaks down utilization by engagement type. We have this really cool map that shows it's like a heat map of where all the utilization happened. We show month by month, we show trailing 12 months, we show forecasted utilization, because at the end of the day, the folks on this call are making decision, are my employees going to use this? And is this a quality solution? And does it fit my needs? So, Sumas is actually, we drive 5 to 10 times utilization versus the second opinion category, again, because it's broad funnel, where it's not just a narrow thing. So we're really proud of it. We hold nothing back. It's very transparent. It's real time. We'll show outcomes data. Interesting point. I looked at our dashboard yesterday. 92% of our Sumas MD consults, our members are saying they feel more informed on what they need to do in healthcare after talking to them. So really, all those kind of data points, we track outcomes. We show that to our customers.
Well, a related question is, how do you review / audition your specialists, and do patients rate them on your platform?
Yeah, that's a really good question.
Like ZocDoc.
Yeah. So let me talk about 2 separate pieces. We evaluate our physicians very quantitatively, and we basically built an algorithm that says, okay, where did they train? How many years of experience do they have? What health system are they practicing at? Importantly, we capture procedure and treatment volume. So the biggest indicator of success, if you want to get your hip replaced, is you want to go to somebody who's done it 200 times a year. You don't want to go to somebody who's done it 5 times a year. So we build it on top of that, and then we really we tie it to the specific diagnosis, right? So just because somebody's a cardiologist doesn't mean they can treat your heart issue. It really is about subspecialty beneath that specialty.
Okay.
So let's just call it an algorithmic sort of qualitative assessment of a specialist. Now, what happens every time somebody talks to a specialist, we get feedback scores on everything. Did they help me? Did they inform me? Did I change my course of treatment? Did I avoid a surgery? Do I feel more informed about what I need to do? And how would I rate my overall experience? And so we have all that data. We don't make it public. We can show it to you, the benefits leads if they want. We don't make it public because I think doctors have a very negative viewpoint of rating systems, especially outcomes-driven rating systems, because you can be an incredible doctor in a certain part of the country and your outcomes could be way, not as good as somebody in a different part of the country, just because of the demographics and the sort of the health of the population and whatnot. So we believe in curating quality on the front end. We do get incredible amounts of feedback on our doctors, and it informs our matching, but we're not making it public to everybody to see, because that, great specialists don't like to be rated that way.
Understood. I have a follow-up question on that, but first I want to bring Steve back on just briefly.
Yeah.
Thanks very much, Lydia. I would just like to thank you all for tuning in. And just a moment here, I want to, I will tell you at the end, we're going to give you a special offer for another event. Back to you, Lydia, for more questions.
No problem. That was a good teaser. So now everybody has to stick around until the very end and hear what the special offer is. Don't go away. Don't go away, folks. Okay, but just talking about the reviews, and I don't want to belabor this point. Obviously, they feel like they are, not in a place to be like in a Yelp review, let's say. But I do think, though, that the type of reviews that are on a platform like ZocDoc, where it says, this is how long I waited, this is how personable somebody was.
Yeah.
Those kind of ratings do have some value for people, don't you think?
They totally do. We're not an open platform like ZocDoc, right? So on ZocDoc, you can, because the difference between specialty care and just like choosing a doctor and ZocDoc is that, you can come to us and say, I've got a migraine. And the reality is you've got a pretty serious neurological problem that we don't find out until you get into our system. So your point is a good one. I fully support rating systems that are solid, and ZocDoc is a wonderful company. I love that company. We just don't show it externally to our members.
Got it.
So yeah.
Okay, moving on. Another question. During the pandemic, it seemed like insurance companies were quite liberal about paying for telehealth appointments, but now they're pushing back. How do you think this situation will get resolved?
It's tricky. I think some of them will extend it. Ultimately, I think they're going to pull it back, and it's not going to be, ideally we're at parity for telehealth. I do think, we're not a second opinion company, but there are components of what we do that's very second opinion-y. Insurance may cover that in the future because there is a clear ROI tied to that type of thing. I would not hold my breath that insurance companies are going to do what's in the best interest of consumers, which is parity.
Okay.
Not to sound overly cynical.
What kind of feedback have you gotten from corporate customers, including things they asked you to fix or do better? See, you wanted a hard question. There's
no, it's a great question. I think it's, we've gotten some, early on, we got some feedback on our communication materials in terms of, being a little bit tighter on certain aspects so that consumers know what to do. Some occasionally we'll get truly, and this is not me just being the founder guy, but, the negative feedback we get is oftentimes technology that we cannot control. Okay, so let me give you an example. A physician is doing a consult in her office right next to the x-ray room and their Wi-Fi is terrible. And so we get, that we obviously that's our problem. And we have ways to make sure that physicians don't do that. But if a consumer, if an employee is in the middle of nowhere and their Wi-Fi is not good and it's kind of erratic, we certainly take the blame for that. So we happily do that. We try to put the best, measures in place to make sure that doesn't happen. But overall, I'm really happy to say that our feedback's been very good. And I think the benefits heads have been extraordinarily happy with Sumas and putting it in for their employees.
Well, without name checking anyone, are you dealing with a spectrum of the size of employer that is your client base? Because I think that's probably a question that a lot of people have. Like, are you, dealing just as much with small businesses as you are with enterprise?
We are. I mean, we have 50,000 person companies that are clients of ours. We have 2,000 person high talent, sort of tech or financial services companies that are clients of ours. We have 7,000 person, leasing companies that are clients of ours. We also have platforms, right? So we work with aggregators of lots of small businesses. That's a really nice channel for us. There are benefits admin platforms that offer a service to thousands of small businesses out there that we're able to go through them to reach those thousands of small businesses.
Okay, so we do have businesses with under 100 people that are using this.
Yep, we do. Yep.
I've heard about inconsistencies in state regulation of telehealth that causes hardship or inconvenience for patients. Is that going to be a chronic problem? Is there a need for federal guidelines? Oh, see, they took my crystal ball comment seriously. They're asking you to look into the future.
Yeah, yes, and yes. Look, I mean, these are state-by-state guidelines that are set by state medical boards. Telehealth laws are always evolving. We do a quarterly check-in with our outside counsel on, how are the laws in Texas going? Are they stuff like that? There certainly is an argument for federally mandated law here. But the reality is the reality, which is states are incentivized to think about their hospitals within their own systems, their populations, and there's lots of tension that happens where, people in, I don't know, people in Virginia don't want their people going north. So it's a challenge. It's certainly, this is the thing you need to check with, or companies like ours. We always need to, make sure that we're up to speed on the latest state regs, and, good companies will be doing that for your employees.
We have a question about mental health. And so I just first want to clarify, are you offering any mental health services on the?
We are. We
Okay.
offer mental health navigation, and I can clarify. But
Okay.
let me hear
Well,
your
the question is, what advice or examples do you have to share as it relates to health and using virtual care to serve rural or hard to reach communities and demographics?
Yeah. So it's sort of the same answer that I gave before. The beauty of virtual care is that consumers are getting much more comfortable with mental health driven to a virtual medium. The difference between traditional medical care and mental health medical care, they're sort of one and the same, obviously, is that mental health, often you need repeat care, right?
Mm-hmm.
So you sort of ongoing engagement over weeks and months and whatnot. So, it's important to think about that. I would offer this consideration as you think about, there's been a lot of money put into virtual mental health companies. There's a shortage of supply, meaning, remember I talked about this doctor problem. There's a shortage of mental health professionals that are quality mental health professionals that are engaging with people through platforms. So that's been a challenge for employers. We've chosen to go at it from a very high quality model. So we have almost we call them Summas MD psychiatrists, basically, who are available within hours to our members, can help them understand their modalities of care and guide them to the right in-person or virtual care that aligns with their plan. So it's part navigation, part sort of consultation, and helping people understand what's optional, what options are good for them. So definitively it works in rural areas, hard to reach areas. Yeah, definitely. Yeah.
And you said they're psychiatrists, not psychologists.
We have both.
These are they're both okay. No,
Yep.
just to clarify, because
the psychiatrists can prescribe medicine. We don't prescribe medicine. That's important. Yeah.
Right. Yeah. So we have a reprise of a topic that you touched on earlier. Are there particular specialties that lend themselves to this approach? So maybe it's worth reiterating what you talked about before.
Yeah, I mean, we do consultations, virtual consultations, single multi-party from anywhere in the world, where, mom can participate from Texas, son can participate from California, doctor can participate from New York. There's really no, we can be looking at a brain tumor case where they're looking at DICOM imaging and they can see all the, the brain and the slices of the brain and all that kind of stuff, and the history. To an MSK issue, which is, hey, I've got nerve damage in my knee. Do I need surgery? And, we work with HSS, we worked with UCSF on the West Coast, all incredible doctors who've looked at a ton of these cases. And then just to a basic consultation. Hey, I'm having migraines. What do you think's going on? How long have you been dealing with it? It's a powerful model because it's really just about exchanging expertise with the healthcare consumer. So that, obviously, if you need tests, we're going to direct you to in-person care. Mm-hmm. If you need a treatment or a procedure, we're going to direct you to in-person care. But really everything else, there's no limit to what you can do virtually through our platform. So, yeah.
Two somewhat related questions. They're concerning the physicians. One is, you're offering the best doctors, but what's attractive to this platform for specialists who are already in high demand given their reputation? And another says, are they carving out time out of their regular practice to take Sumas calls? How does this work with their regular day jobs?
Yep. So the answer is yes. Some doctors will choose to just do it on the ends, but we have doctors who do Sundays, Saturdays, Monday morning at 7 a.m. If they have a hole in their schedule, we've got sort of a scheduling app that they can just, very quickly, confirm. I'll say this again, I go back to my opening. I come from a family of doctors. I deeply understand the mindset of specialists. There are real challenges to specialists, to doctors in this system. And I think part of what we do is make it very attractive for them as an experience. We have a deep respect for medicine. We have a deep respect for their expertise. We create a different marketplace for their expertise. So they are willing to do it. We have some of the best in the world that worked actively through Sumas across really all specialties. And remember this: we're not creating some weird black market. We're a funnel for new patients into high quality health systems, right? Centers of excellence. One of the top priorities for companies out there is, expand access to centers of excellence. That's what we do, right? So if, Walmart pioneered this, right? They're basically paying for people to go to centers of excellence to get treatment, and the outcomes and the cost impact is actually better than if they just kind of stayed in their own sort of localized healthcare system. So, we work with our platform. We also power. We use a SaaS platform to help health systems scale their expertise across domestic and international boundaries. So it's very much a partnership between us, the physicians, and the health systems to provide amazing access to high quality doctors that allow them to increase their patients. And also just provide a quality experience and pay them for their time for what they're worth. So. Yeah.
Well, speaking of being paid, one of the questions that I had for you that is now echoed by one of our audience members is that HR leaders who are balancing cost and quality and access as they look to change their benefits offering, how does it work? Like, is this going to help bring down costs, or is it just about access?
No, it's absolutely, there's a cost argument, right? So what's amazing, so everybody on the phone who's running benefits knows this, but 5% of a population are typically driving 50% of your claims costs, right? So there's a huge concentration. Those are NICU issues, post-pregnancy complications, complicated MSK issues, heart disease, and oncology. Those are the top 5, right, in terms of claims cost. There is very clear data that says fast access to high quality doctors drives much better outcomes, right? Because you're not running around healthcare doing silly stuff, getting bad tests, getting bad advice. And that's why the centers of excellence concept, right? So from a cost perspective, we are a huge lever because again, we focus in specialty care. That 5% of cases, those are all specialized cases. Those are not sore throats and fevers. So we're really taking that traditional second opinion category and bringing it to a much better place, right? With a much broader funnel around hundreds of other types of conditions. And in terms of we have a very reasonable cost structure. We average 2-to-1, 3-to-1 ROI on the high end for all of our customers, and that's a combination of 2 things. Very simple, and everybody on the phone knows this. We drive higher utilization than our competitors, and the quality of our offering is higher in terms of the quality of the doctor, the quality of the experience. So those 2 things come together with a really powerful sort of avoided savings per engagement, which is right around $6,500 or so per engagement. And we have some clients who are doing 20% utilization. We have some clients who are doing on the low end, call it 5 to 10% utilization. So you can see, when you combine that with the quality of our offering, you get lots of opportunities to help people make better decisions in healthcare and ultimately save you and the company money. Yeah.
Well, and that's the bottom line. And we are just about out of time. I'm going to invite Steve back on again, but Julian, thank you so much for spending the hour with me. It's been enlightening.
Yeah, that was fun, Lydia. Thank you. Yeah.
Well, thank you both, Lydia and our speaker, Julian. That was a great conversation on a topic that companies and consumers have a lot of questions about, as you saw. Thanks again to our sponsor, Sumas, and to all of you for participating today. In the last minute, I'd like to remind you about something special we have for those of you who are attending. Our next conference is coming up on Wednesday next week, and it's about diversity's many roles. Thanks to our sponsors and today's sponsor. We have some complimentary VIP tickets available for you. I'll put a link in the chat right now for a free ticket for the conference. If you'd like to join us for more virtual events, you can head to our website, fromday1.co, and check out more of our upcoming webinars. Besides our conference next week, I'd like to mention one in particular. On Tuesday, July 27th, we'll be looking at solving the hourly worker shortage using recruiting, tech, and data. So thanks very much for attending today, participating. Thanks everyone. Stay well.